You're pregnant, you're protecting your baby, you're counting weeks, and then suddenly you see blood. Your heart drops, your hands shake, your mind races. Is my baby okay? Am I losing this pregnancy? Here's what many women don't know. Bleeding after 20 weeks of pregnancy is not something to ignore. And globally, antepartum hemorrhage remains one of the leading causes of maternal and fetal complications. Today, we're talking about the pregnancy emergency many women are not prepared for. This could save a life. Welcome back. If you care about safe pregnancy, maternal health, and protecting both mother and baby, this conversation is critical. Today, we're discussing antepartum hemorrhage, APH, what it means, why it happens, who is at risk, and what every pregnant woman must know. No fear, just facts and life-saving information. What is antepartum hemorrhage? Antepartum hemorrhage simply means bleeding from the genital tract after 20 weeks of pregnancy and before delivery. It is not spotting in early pregnancy. It is not your period returning. It is a warning sign. Even small amounts of bleeding in late pregnancy require medical attention. Why is it dangerous? Because bleeding during pregnancy can mean reduced oxygen to the baby, preterm birth, severe maternal blood loss, shock, emergency delivery. In many parts of the world, delayed response is what turns manageable bleeding into tragedy. Early action saves lives. The two main causes: 1. Placenta previa. 4. This happens when the placenta lies low in the uterus and partially or completely covers the cervix. When the cervix starts preparing for labor, the placenta can bleed. Key sign: painless bright red bleeding, no pain, just blood, and that's why some women underestimate it. 2. Placental abruption. This occurs when the placenta separates prematurely from the uterus. Key signs: painful bleeding, abdominal pain, back pain, uterine tenderness, reduced baby movement. This is an emergency. Risk factors. Certain factors increase the risk: high blood pressure, previous cesarean section, multiple pregnancies, smoking, trauma to the abdomen, previous history of APH. But listen carefully, it can still happen without warning. What should you do if you see bleeding? This is not the time for Google. This is not the time for prayer alone. This is hospital time. Practical steps: lie down on your side. Do not insert anything into the vagina. Do not attempt intercourse. Do not self-medicate. Go to the nearest hospital immediately, even if the bleeding stops, especially if the bleeding stops. How do doctors manage it? Management depends on amount of bleeding, baby's gestational age, mother's condition, underlying cause. Doctors may admit for monitoring, give steroids to mature baby's lungs, provide blood transfusion, perform emergency cesarean section if necessary. Modern obstetrics has saved countless lives, but only when women arrive early. Pregnancy is beautiful, but it is also medically complex. You are not weak for going to the hospital. You are not overreacting. You are protecting 2 lives. Bleeding is not something to wait and see. It is something to act on. Can it be prevented? Not always, but you can reduce risk by attending regular antenatal care, controlling blood pressure, avoiding smoking, reporting reduced fetal movement, seeking care immediately after abdominal trauma. Antenatal care is not a formality. It is prevention. Antepartum hemorrhage is not rare. It is not dramatic storytelling. It is real. But with early detection and proper medical care, outcomes improve dramatically. If you are pregnant, or you know someone who is, share this information. Because sometimes the difference between panic and protection is knowledge, and knowledge saves lives. If this video educated you, subscribe for evidence-based women's health information. And if you are pregnant, stay informed, stay monitored, stay empowered. Your life matters. Your baby's life matters.